Hello, world and universe. Welcome to the Trevor Donald Experience. Manifest your truth. And if you're new to the channel, please hit that like and subscribe button. And for all my continued followers, I want to say thank you. And this is an opinion-based video channel where I try to open your eyes and ears up to some of the travails and tribulations that take place throughout our cities, our states, our country, and sometimes around the world. Well, this is one of my greatest times of the year outside of it being winter. We got the NFL playoffs, and being originally from Chicago, my Chicago Bears are in the second round of the playoffs, and they are playing the Los Angeles Rams tonight. So go Chicago Bears. But this story I want to get into has everything to deal with a healthcare company and Medicare and Medicaid fraud. You're seeing a lot of pop-ups of people doing, or companies doing telemedicine, where they're sending out flyers or calling folks to try to get them to sign up with their healthcare center or company based on them having Medicare. And for those who don't know or remember, Medicare is a government-based healthcare plan for people 65 and over. Unless you are under 65 and you have been diagnosed with a disability. You can get Medicare if you're under 65 if you're disabled. So it's designed for people 65 and over, and for disabled people under 65. They can have Medicare and Medicaid. And there are some companies, even here in St. Louis, that promote and market towards Medicare patients only. Places like Dedicated, Oak Street Health, Archwell. These are some of these healthcare companies that are here that are primarily seeing Medicare patients on a regular basis. And these pop-ups are all over the country. Not saying they've committed any fraud, but these are some of the companies you may run into, like Oak Street Health. And then on your Medicare, you have a supplemental that's part of it. It can get a little complicated. You have your own Medicare ID number, like a Social Security number, and then you get to pick a supplemental. Normally that could be Aetna, Cigna, Humana, United Healthcare, and these are some of the areas where these healthcare companies will bill your Medicare, your Medicare, Medicaid, your supplemental, Humana, United Healthcare. That's where they will bill your healthcare agency or company when you have Medicare, if I'm making sense. So there's a lot of money out there for people, for doctors and hospitals and healthcare centers to make money off of you if you have Medicare and or Medicaid, and some of these companies and individuals are abusing that power. And we have one here. You got to listen to this. Is a whopper. The CEO of a healthcare software company was sentenced for a $1 billion fraud conspiracy. An Arizona man was sentenced to 15 years in prison in order to pay more than $452 million in restitution for conspiring to defraud Medicare and other federal health care benefit programs. That's what Medicare is, a health care benefit program. He defrauded Medicare and other health care benefit programs of more than $1 billion by operating a platform that generated false doctor's orders used to support fraudulent claims for various medical items. So remember, this guy got 15 years in prison. He was ordered to pay more than $452 million, but they say he defrauded Medicare by over $1 billion. So it goes on to say this just sentence is the result of one of the largest telemarketing Medicare fraud cases ever tried to verdict, said Acting Assistant Attorney General Matthew Galliotti of the Justice Department's Criminal Division. Telemedicine scammers who use junk mailers, spam calls, and the internet to target senior citizens steal taxpayer money, and harm vulnerable populations. The criminal division will continue dedicating substantial resources to the fight against telemedicine and medical equipment frauds that drain our health care benefit programs. Together with our partners, the FBI will aggressively pursue those who defraud taxpayer-funded healthcare programs, said Acting Assistant Director Rebecca Day of the FBI's Criminal Investigative Division. Programs like Medicare are intended to help the most vulnerable among us, and fraud schemes like the one orchestrated by the defendant can jeopardize the delivery of critical care to those who need it most. This sentence sends a clear message. Those who exploit telemedicine to prey on seniors and steal from taxpayer-funded healthcare programs will be held accountable, said Deputy Inspector General for Investigations Christian Schrank of the U.S. Department of Health and Human Services, the Office of Inspector General. So that's the HHSOIG, Health and Human Services, Office of Inspector General. Remember that, and remember that acronym, HHSOIG. This scheme was a massive betrayal of trust built on deception and greed. Our investigators, working with law enforcement partners, dismantled this billion-dollar fraud operation that targeted vulnerable patients and undermined the integrity of Medicare. We will not relent on our mission to protect the public and safeguard Medicare and other federal health care programs from fraud, waste, and abuse. This sentencing underscores the Veteran Affairs Office of Inspector Generals, the VAOIG, its commitment to vigorously investigate those who would seek to defraud the VA healthcare programs. So these are some of the people these are the types of people that are targeting: over 65 veterans to try to utilize their Medicare benefits, said Special Agent in Charge David Spilker with the VAOIG Southeast Field Office. The VAOIG thanks the Department of Justice and our law enforcement partners for their efforts in this investigation. So remember, the VAOIG is the Veterans Affairs Office of Inspector General, VAOIG. This investigation underscores the Defense Criminal Investigative Services, the DCIS, Defense Criminal Investigative Services, commitment to protecting the integrity of the TRICARE program. You should have heard, for those who have grandmothers and people that are over 65, you should have seen the word TRICARE program before attached to Medicare. And ensuring that taxpayer-funded military health benefits are not exploited for personal gain. Fraud schemes that siphon resources from TRICARE directly undermine the care promised to service members and their families. As the criminal investigative arm of DOD, Department of Defense Office of Inspector General, the DCIS remains focused on disrupting these schemes and holding responsible parties accountable. So, according to court documents and evidence presented at trial, Gary Cox, 79 years old, of Maricopa County, was the CEO of Power Mobility Dr. RX LLC, or DMERX. This is out of Arizona, Maricopa County. Cox and his co-conspirators targeted hundreds of thousands of Medicare beneficiaries who provided their personally identifiable information. You get a Medicare number, like a Social Security number, should not give it out, and agreed to accept medically unnecessary orthotic braces, pain creams, and other items through misleading mailers, television advertisements, and calls from offshore call centers. Cox and his co-conspirators owned, controlled, and operated DMERX, an internet-based platform that generated false and fraudulent doctors' orders for these items. orthotic braces, pain creams, etc. As part of the scheme, Cox connected pharmacies, now listen to what he did, durable medical equipment suppliers, DME, and marketers with telemedicine companies that would accept illegal kickbacks and bribes in exchange for signed doctor's orders transmitted using the DMERX platform. Cox and his co-conspirators received payments for coordinating these illegal kickback transactions and referring the company's doctor's orders to the DME suppliers. Remember, that's the durable medical equipment suppliers, pharmacies, and telemarketers that paid kickbacks and bribes for the orders. The fraudulent doctor's orders generated by DMERX falsely represented that a doctor had examined and treated the Medicare beneficiaries when, in fact, purported telemedicine companies paid doctors to sign the orders without regard to medical necessity. Based only on a brief telephone call with the beneficiary or no interaction with the beneficiary at all, the DME suppliers and pharmacies that paid illegal kickbacks in exchange for these doctors' orders billed Medicare and other insurers for more than $1 billion. And Medicare and the insurers paid more than $360 million based on these claims. According to the evidence presented at trial, Mr. Cox and his co-conspirators concealed the scheme through sham contracts and by eliminating from the doctor's orders what one co-conspirator described as dangerous words that might cause Medicare to audit the scheme's DME suppliers. In June 2025, Mr. Cox was convicted of conspiracy to commit healthcare fraud and wire fraud, 3 counts of healthcare fraud, conspiracy to pay and receive healthcare kickbacks, and conspiracy to defraud the United States and make false statements in connection with healthcare matters. So the FBI, HHS, OIG, which is Health and Human Services, Health and Human Services Office of Inspector General, the VA OIG, and the DCIS investigated the case. Since March of 2007, this program, currently comprised of 9 strike forces operating in 27 federal districts, has charged more than 5,800 defendants who collectively have billed federal health care programs and private insurers of more than $30 billion.